Hello everyone. This is a small recap for those people who are not the Hematomorph channel member regarding the session that we had yesterday about transfusion cases related to obstructed hemorrhage and arrangement of blood in that positive hemolysis. So the first question was about obstructed hemorrhage, and the obstetric registrar contacted the hematology registrar for advice. The most important in this assay was um, activation of major hemorrhage protocol. If you fail to mention this early in your essay, it means you have poor judgment and it may cost your essay. So the patient was bleeding and the patient was in shock as well. You need to activate your major hemorrhage protocol as soon as possible. If it is not done, you have to mention that in your essay. This essay is designed for major hemorrhage protocol. And then, yes, you have to follow the major hemorrhage protocol algorithm. And then once it is once the patient is stable, then you have to mention that we have to turn down the major hemorrhage protocol as well. And it is better to mention regarding advice of NTD prophylaxis or NTD injection post major hemorrhage protocol, because your hospital may not have D negative blood for the negative patient. The patient may have received D positive blood. So you have to mention that after the major hemorrhage is over, we need to figure out whether the patient has received D positive blood and she is D negative or not. If this is the case, then we need to find out how much D positive blood she has received, and we have to act accordingly, which means either high doses of NTD or red cell exchange if the units are 2 or more than 2. Then the second question was about DAT positive hemolysis and arrangement of blood. Yes, the DAT principal causes of DAT positivity, it was well attempted by all, but the problem is where when you mention about the arrangement of blood for the patient. The patient was a male patient, and you have to divide or categorize the answer into two, which is emergency blood or non-emergency blood. And emergency blood means that your patient is dying or very unstable. You have to give blood whatever is available in your hospital. In UK, we have emergency packs, which are ORH negative. But the patient is male, so you have to mention that this patient can be given ORH positive blood as well, because we are not concerned about the antibody formation in male patient unless he is a regular transfusion dependent patient. If it was a female patient, then my first priority would be ORH negative blood for D negative patient. And if the patient had received D positive blood, then I have to give her anti D prophylaxis accordingly. Then the second heading is non-emergency blood. Then it means that the patient can wait till the RCI lab finish its testing and you have the fully matched blood available in your hand. RCI usually would take 6 to 8 hours. In my deanery, it is 6 to 8 hours for the all the testing to complete. It may differ in different in your deaneries or in your country hospital as well. And then the information that you need to give to the patient. Information does not mean that you just say that you have hemolytic anemia uh, and, and that's it. No, you have to tell the patient that you have hemolysis, and it is autoimmune type of hemolysis. And what is autoimmune type of hemolysis? We have mentioned that in the lean language, that your body is destroying your own cells. And Why this is happening, you have to tell the patient different causes, primary or secondary causes, and what investigation you would like to do to find out these causes. So all the infection screen, malignancy screen, and the blood filming, virology, etc. You have to mention to the patient. What are the treatment options? You have to tell this patient that we may give you blood transfusion, steroids, IVIG, and if not working, then plasmapheresis as well. So you have to mention that to the patient and consent the patient as well. Um, the patient can be a Jehovah Witness, or he may not be a Jehovah Witness but still refuse blood. So you need to be careful about consenting. Um, if there is transfusion related stuff, like blood transfusion related stuff in your essay, just in one bracket mention if not Jehovah Witness or if patient agree. Then your aim of mentioning to the examiner regarding consenting or Jehovah Witness is complete. And this patient will need steroid, so for the steroid you have to mention steroid card as well. Rest, I'm happy to be contacted if you have any questions regarding that. This short video is for those candidates who are not the channel member or who have difficulty to become a YouTube channel member due to geographical restrictions. Thank you.